Hello and welcome to all our viewers from around the world. I'm Kristen Schwartz, licensed midwife and MC here at Gold. And here at Gold, we're really excited. We're getting ready for our labor and delivery symposium coming up. And with me here today is the amazing, the wonderful Karen Strange. Welcome, Karen.
Hi, Kristen. Thank you.
Welcome back, I should say. You have been with Gold a few times, having some presentations with us, right, Karen?
I think like 6 or 7.
That's right. That's right. And we appreciate you, and you're back by popular demand because, your presentation this time for the Labor and Delivery Symposium is titled The Remarkable Transition from Liquid to Air at Birth, the Implications for Neonatal Resuscitation. And we're going to talk about that in just a moment. But first of all, Karen, where in the world are you for our international viewers?
Well, I'm here in the United States, and I recently, 9 months ago, moved to Virginia. So the eastern coast.
See, that's new because last time we talked in the in previous years, that's not where you were. So good thing.
I was in Maine. Right, I was in Maine. Right. Right. Yeah. It's like perpetually warm.
Yes, that's right. So Karen, you are a midwife, right? And
Yes.
Neonatal resuscitation instructor and so much more. So tell us a little bit about your background. How did you end up in this, that you loved teaching so much? How did it even happen that from midwifery to that teaching? So give us a little overview there.
Sure. Well, I trained as a midwife. I trained in the border of between the United States and Mexico, and school, and got to see lots of births while I was there. And the NRP program, let's see, in 1988, I became a midwife, and I was working there. And the NRP program actually started in NRP is the Neonatal Resuscitation Program, which is part of the American Academy of Pediatrics, for anyone that doesn't know. And they started this Neonatal Resuscitation Program in 1987, and it came to the town that I was in. And, all of the midwives went to the hospital and took this course because, we wanted to be able to teach it to all the people that came there to train, and people came from around the world to train. And at Maternidad La Luz, and I eventually moved to Dallas, Texas, where I had a home birth practice, and I just started. I became an instructor. I'm sorry, I skipped that. So we took it in '89, and then like in 1990-ish, the owner of the birth center and myself became instructors, Deb Cayley, and we became instructors, and basically she taught most of the classes there. But then I moved, and I had a home birth practice, and I started teaching locally. And then somehow somebody said, here's this midwife, and she teaches it a little more out of hospital. And I went there, and then I started learning about the evidence-based studies behind the neonatal resuscitation book, which really kind of like, I would say that evidence-based wasn't as big a thing then as it is now.
Yeah, absolutely.
And it really opened my eyes to like a bigger picture. Not that the book isn't fabulous and encompassed a lot, but I really, it expanded my understanding of what was happening. And then I learned about the UK manual, and I met, Judy Mercer, who hopefully your audience is familiar with. Judy Mercer has published many papers on delayed cord clamping with Deborah Owen Erickson. And she was kind enough to give me her slides, and I started incorporating a little bit about the science behind cord clamping, because it was fascinating to me to really like visualize what happens, and not just out of book. And I thought, oh, I could explain that. And, I just started explaining it. And then I started to learn about pre and perinatal psychology, about the baby's experience, and everything that I was learning about myself and understanding about memory and my birth memory and places that I trained. I started incorporating that into my neonatal resuscitation training. And then people would say, oh, you've got to take it from, and it sort of grew. And So I did a lot of flying and teaching and, from location to location. But my goal really was I wanted them to have an understanding of the baby's experience. I wanted to give them tools for when things don't go as planned, like a resuscitation, right? And when other things happen, what are simple things that can be done to help integrate the baby's experience? But I also wanted them to really feel like they knew what to do with a baby not breathing or not breathing well. I didn't want them to have to think about it. I wanted them to know black and white that they could do it. And I'm highly repetitive for a reason. And that's just, and it grew. So I've taught like 14,000 people now.
14,000. That's an amazing number of people you taught. That's incredible. Yeah, and for
I
good reason, because your
show
training
it.
is different from just the normal NRP. You added so much to it, which makes a lot of sense, as you mentioned, there as well. And it makes sense also to look at, also just at the anatomy, just going back to the very beginning when like how amazing it is to, think about, okay, this baby has not been breathing in utero, of course not, right? And this transition from liquid to air is like an incredible transition, right? So I think we always kind of overlook that factor where, once the baby is born, immediately everybody jumps in. Is the baby breathing? Is the baby breathing? And remembering that there is a transition that is happening, right? That I think is very valuable. And that's one of the things you teach really is like, wait a minute, let's not everybody rush in and chaos and, but really to take a moment and really evaluate, and also our own energy, to what our own energy brings to the table, brings to the birth room as well. And that's this is what I appreciate so much about you, Karen. So tell us a little bit about that, about our own energy. You talk about that a lot, and what it means, and what can we do as well in this situation.
So I just want to back up. I just want to make it clear. I do like to stress understanding normal.
Yes.
And that there is this pause that's embedded in birth, and to take a moment and to wait. But certainly not many, some babies don't get that minute. They don't get that moment because they need to immediately.
Of course. Yes,
be
of course.
So just to be clear that I'm
yes.
not.
No. Yeah, I'm sorry that was not clear,
no,
but yes.
Yeah. And I have to say that's a big piece of what I try to get across, that most babies, something like 98% of babies, really everybody just needs to take a moment. And there is this other percentage, and I want you to feel confident and competent in how to respond to that. But it's true, what happens when you see anybody not breathing, but especially a baby, like not just a baby, a newborn, like they're not, and at the birth, as you know, the contractions increase and there's all that pushing, and everybody in the room, the family members, the support people, the birthing staff, everybody's working towards this end. So the energy is mounted, and it's a pretty intense energy. Even when it's perfect, it's still, it's still a pretty intense energy. And then, depending on what happens in the labor, there could be heightened anxiety about getting the baby out, or how the baby's going to be when it comes out. So there's this heightened energy. And also there's people fear around birth because, while it used to be that birth was in the home, for many years, it has now been in the hospital. And so people don't see birth, and we watch, emergency shows, and birth is always this big emergency. So anybody that goes into a birth is holding some of that energy. And then also, as I like to talk a little bit about implicit memory, the memory that we have in our bodies from our birth, which we all sort of think that babies have amnesia about their birth experience, but that's not true. Babies are laying down memory of their experience at birth. And while it's not a conscious memory, it's a body memory of what happened. that all comes to birth, and in that moment of birth, everybody is pretty heightened and intense, and especially if you're not sure how the baby's going to be. And so we need a little practice around that, because there's so much intense, fearful, maybe fearful, and very frightened energy. And it's something that you have to practice ahead of time, like everything. And one of those things, is sort of becoming aware of your body. And they say you teach what you need to learn, so it's one of those things for me as well. Periodically dropping in and just becoming aware of where my body is. And time is I'm sitting here looking at the Zoom camera with you, Kristen, right? And I'm sitting on a chair, and maybe I'm so nervous about talking to you that I can't really feel my body. So maybe I'll do a little Kegel, I'll wiggle my toes, keep my attention really into my body, and get curious about that. And that helps me take a breath. I've sort of brought my attention in my body and lower in my body, allows me to take a breath. And this is like a skill that I wish we were all taught from childhood. I don't know. I heard, this is a little while ago, Goldie Hawn has this program, it's been since 2013, where she goes into schools and teaches children how to take a pause, because when you're in school and you're learning, you're thinking all the time. And then she showed, these little elementary school kids taking a pause. But just imagine what it would be like if we did that every day in school, and they taught parents to do it, and then we did it in our middle school, and then we did that in high school, and then we did that when we went to our training to become, a doctor or whatever, or a nurse. And that was just part of what everybody did. It would be really like traumatic experiences happen. They don't have to leave such a traumatic imprint. And often the speeding up is part of what causes the trauma. So slowing ourselves down, even just for a moment, and I'm not suggesting you stop in the middle of resuscitation and pause. I'm saying it's an internal process that you have to practice when it's not an emergency. So you've hardwired that little practice into your body. And I teach this in my resuscitation class, that while they're practicing breathing the baby and doing their, breathe 2, 3, breathe 2, 3, when they're doing their counts too, once they have their counts down, I also say, now feel your knees on the floor, or feel your feet on the floor, right? And what that does, they got their count, they do that, like I'm doing a little Kegel while I'm talking, right? And so I embody my action, and then I do my action better.
And I think that's a very valuable thing that you're teaching, because especially in an emergency, to the provider or to the team, it almost feels like an out-of-body experience, that you're doing your things, but you're not, almost feels like you're not there, but you're watching from, it is a really surreal, I'm sure you know what I mean, Karen, right? So having this kind of, feel your feet on the floor, is kind of this grounding and breathing, because that helps you, the provider, to do a better job, to be rather than having this out-of-body experience that can also be quite scary as well. So thank you so much for teaching that here and bringing that to us as well. And just even in the talk that we had here, that you did that, so we can really do that anywhere, and it is not taking away, as you said, if a baby needs our help, we're not standing around there and meditating, which that's not what we mean. It could be just something in the moment, that while we're doing things, right, while we're working, and with the breathing with the baby there, that can be done. So that's so valuable. So thank you so very much for being here, Karen, with me, and for the presentation that you have for our Labor and Delivery Symposium. It was such a pleasure having you here.
Thank you, Kristen. It was great being here. And I love gold.
Thank you.
All the lectures.
And for our viewers now, our Labor and Delivery Symposium is going to be here very soon, October 16th. We get started with our keynote presentation that is open access, so make sure you sign up for that. And then there will be, the recordings will be there for you as well at the following days then. So make sure you check out goldlearning.com for all the informations on the recordings, on the presentations, and of course on the keynote as well. Thank you everyone for watching. Have a lovely rest of your day. Bye-bye, everyone.